Definitely like recording nothing, but it's okay.
Oh, smart.
Oh no, I am. But she's not doing anything yet. So I just started it. Look at that heart, it's huge. My heart not that big.
Other way, I don't know if that matters.
Can I bring that closer?
Oh, I think she has to, if you want to scoot over, she said keep it in front of the bed.
Oh, that's the art.
Yeah, so it's fine. He's under business.
Oh my gosh,
Yeah, that's ridiculous. It's so hard to go wrong. Okay.
This is so innovative.
yeah. I kind of want to take a picture of myself with the heart.
Be like,
Yeah. When I saw it, I was like, because I'm Mexican and we do a dish out of cow tongue.
yeah.
And it kind of looks like that.
Yeah.
I was like, I probably shouldn't share that with
I
people.
mean,
Okay,
no,
the first thing we
in my
have to
country,
do
they can
is
count on too.
determine the front of the heart from the back of the heart. Sometimes when these get embalmed or preserved and then stacked up in a shipping case, they get pressed out of their normal arrangement or appearance. So they may be kind of squashed, is my point. Sometimes they are, sometimes they aren't. Mine doesn't. Mine appears to be a little bit squashed on the back, but the front seems fine. The first thing you want to do is point to the apex, okay? And then tip the heart, set the apex down, and up here at the top, you should find these two big flaps of tissue, which are the auricle flaps. The atrial chambers would be inside them. And right in between them, there should be some large vessels connected by connective tissue. Across the top of those auricle flaps is basically the base, so right across here. So I'm going to give you a minute to make sure everybody finds these big elephant ear, we call them ear-like flaps, okay, elephant ears. Those are the auricle flaps that are the external extension of the atrial wall, okay? So we now have apex, base, and auricle flaps, okay? You can see those auricle flaps whether you're on the front or the back of the heart. But the next thing we have to determine is which is the front and which is the back, okay? If you put your hands on those auricle flaps and you find right in between them a very large, tough vessel, okay, coming right up out of one of the heart chambers, that is the pulmonary trunk, and that tells you that that's the front of the heart, okay? Then you should also be able to find the anterior interventricular groove with some coronary vessels and yellowish creamy fat in it, okay? In contrast, the back of the heart, while you can still get hold of the two auricle flaps, if you look in between here, you don't find any large vessel. You find connective tissue and some cut-off vessels, okay? You don't find that big, intact, arching pulmonary trunk, okay? You will, however, see an interventricular groove with fat in it and one big, large vessel at least. That's the posterior interventricular groove. So this is the view on the back of the heart. In contrast, this is the view on the front of the heart with the pulmonary trunk coming out of the right ventricle and the anterior interventricular groove running at an angle away from the apex. It doesn't run down towards the apex. Okay, so I'm going to give everybody a minute. I'm going to point all those things out again. Okay? Auricle flaps, pulmonary trunk in between them coming right out of the superficial or surface right ventricle, anterior interventricular groove, common wall between the ventricles, apex, base across the top of the auricle flaps. And on the back of the heart, here's your two auricle flaps again, apex, posterior interventricular groove runs more towards the apex. Okay? no big arching vessel, intact vessel coming out of a ventricle on the back.
So,
But that's how you tell front from back is by finding the pulmonary trunk intact vessel in between the two auricle flaps and coming right out of a ventricle.
so this is our.
Okay? I'm going to give you a minute to make sure everybody's figured out front from back.
This is our. Back is so.
These are our atriums.
These are right. Okay. This is our.
What is my finger?
This is our trunk. This trunk. What is this?
Okay, so let's name these 4 chambers or areas of the heart as viewed on the surface. Right atria, right ventricle, left atria, left ventricle. Anterior interventricular groove. Apex, base. Pulmonary trunk artery.
Pulmonary trunk.
Okay, we have to do 2 more sulci. The common wall between the auricle or atrial flaps and the solid ventricle that you can actually stick your fingers in this groove here, that's the atrioventricular groove, right, left. It's also known as the coronary groove or sulcus. So right coronary sulcus, left coronary sulcus. There is a lot of fat in there, okay, but you can actually feel this groove, okay. It's where the atrial wall joins the ventricular wall. Right coronary sulcus, left coronary sulcus. Right atrioventricular groove, left atrioventricular. Okay? We do not find hearts with colored dye injected in the vessels. So that's one of the reasons your assignment list is shorter, is these coronary vessels that you had to know on the model, at least some of them. You do not have to name any of those vessels because you can't tell the arteries from the veins because they don't have any dye in them, okay? So even though you can see some of them running through the heart here, muscle here, you don't have any coronary vessels assigned on the dissection map, okay? Now, the next thing we're going to do is, we should have done all the superficial landmarks. The only thing that's left to mention is this membrane that you're touching here is adhered right to the muscular myocardium. It's called epicardium or visceral serous pericardium, and that's what the coronary vessels are running through, running in and then into the muscle, okay? So if we just were to pin this with a dissected pin and just put the pin through this superficial, see I picked it up with my probe. See how I just ripped that off there? You can do that if you want. That is the visceral serous pericardium. Epicardium. Okay? Even with your dull probe, if you just stick it in and pull up, you should be able to peel back a little bit of that and see that this is actually covering over the heart. That's the epicardium of visceral serous. Okay. Now, the next thing, we want to identify the valves, the chambers, and the rest of the great vessels. We need to make some cuts in the heart. So we've done most of the superficial visible structures and landmarks. So we're going to make the first cut, you want to put this left auricle and left ventricle down, and this right auricle and right ventricle should be poking up at you. And it may be, remember, they may be squashed a little bit out of shape. You should see this anterior interventricular groove over here at your side. And you're going to pull a little bit on this right auricle flap, pick your scalpel up, and cut that auricle flap open. Cut down through the anterior interventricular groove, down into the right ventricle. It's very thick. You have to really section and slice slowly with your little scalpel blade. Cut down into the right ventricle, going towards the anterior interventricular groove, but stop before you reach it. Do not cross it. You can bring the incision around a little bit curved as you approach this groove. Don't cross this groove. Okay, you're cutting open the atrial flap, cutting through the atrioventricular sulcus, and opening up the ventricular chamber. measure with your heart before you cut and ask me.
Please walk up my heart real quick.
Okay, when this was the front of the heart and you can see the pulmonary trunk, this is the left side. We're going to put that down, put the right side up, cut the right atria and the right ventricle open, staying above this anterior interventricular curve. It should look like this when you get it open. Okay, I'm going to give you a few minutes to give you time to make that cut.
I'm a professional. I got this. No, I'm just playing. I feel like I cut it kind of
Don't
too
cross
hard.
that anterior.
She said before the line, so
Yeah.
I was trying to make
That's
sure.
what she said you had to go.
I'm really like, what is that?
Right?
I heard this, it was like this really disgusting.
Wash this.
I know, right? I think I touched myself.
It was on my sweater.
Yeah. Oh my gosh, I've gotten to the point.
Okay,
For this
before
lap,
we examine this, I have just one comment looking around. One of the safety rules that is in the inside cover of your lab manual that I didn't talk about is if you have long hair, it should be up or back. So from now on, ladies, please put some kind of a clip or rubber band in your bag so that when we're doing dissection, you can put your hair up or back. It should not be hanging in this band, okay? Which I see happening, right? All right, when you get this cut made, I've turned my light way up. You should be able to pull this open. If you pull it open and there's bits of tissue still attached, then just slice them with your scalpel, okay? Even if it's a valve or whatever, because you got to be able to get a good view here inside the atria and ventricles, okay? So you kind of want to take this auricle flap in your hands now. See what I'm doing? Where we cut, and just kind of turn it inside out so you can get a good look at
I
it.
think it's good.
Okay?
I mean, it's little, but
And you see all those bundles? That's how the cardiac muscle is organized. It's not in flat sheets. Okay, it runs in bundles. And all these bundles of muscle in the atria are called pectinate ridges when they're in the atrial chamber. You can feel the wet serous lining of the atria, okay, over those bundles. And you see on the back wall, it's fairly smooth, but on the front wall, it's very much in these bundled appearance. On the back wall, the atrial chamber, it's more smooth and flat. You can feel the serous lining and endocardium. So these very obvious ridged muscle bands in the atria are called pectinate ridges. Okay? And then, when you look in here, you should see the tricuspid valve cuffs, and you should be able to stick your probe under them. That's a valve cusp, that wet sheet right there. There's another one right here. Okay? The third one you usually cut when you cut it open, so you may have a bit of the valve cusp flapping over here, and the other part should be way inside over on this side over here. You should have at least one intact valve cusp, probably two, and the third one comes across the front, and you should have cut it, so you should have part of it. So you gotta, they just grow off the atrial endocardial lining, and it hangs down into the ventricle. Okay? They do have little tendinous cords. You should find these stringy little continuous cords, and they attach to ridges in the ventricle, like this ridge right here. That's called a papillary ridge, and these are what we mean by tendinous cords. So now find the chordae tendini that attach the cuffs. The big muscle bands they attach them to in the ventricles are called papillary ridges.